Hooyah! This is Robin from Herniated Disc Bootcamp, and today's question is, how do I know if I have a slipped disc or a herniated disc? How do I know if I have a slipped disc, meaning the disc has slipped forward, or a herniated disc where the disc has actually come open and ruptured and you actually have leakage? Okay, this is a good question, guys, and it's a very hard question and diagnosis to put, because these two diagnoses can have very similar symptoms. Okay, and if you have so I'm going to give you some general knowledge regarding this, but if you have a herniated disc, bad herniated disc, usually you have pain that radiates down your leg quite extensively. Okay, and you can have that with a slip disc as well. Okay, but usually you have, with a slip disc, you have it like in one leg. Okay, and that's also common for the herniated disc. Okay, but you can have both of those symptoms in both legs. Okay, and the other thing is also, when you're even when you're walking not far, just shorter distances, the pain with a herniated disc and a slip disc can actually increase. Okay, so that's also a symptom that is similar to that. Okay, then you also have when you're sitting down or when you're lying down. Both of those diagnoses, slip disc and herniated disc, can create more pain. So both diagnoses, you feel usually better when you're moving around. You're not sitting for too long, you're not standing, you're not lying down, you're not walking for too long. Okay, so you see, it's quite complex. Okay, so if you have these symptoms, okay, and you've had them for 6 to 8 weeks, and you're walking around to people and they're all putting these different diagnoses on you, and they're giving you exercises and they're giving you tips and tricks, but nothing is really helping, then you need an MRI. Okay, you need an MRI, because I've been working as a physiotherapist for over 20 years. Okay, and I also have like a really bad back condition myself after playing ice hockey 25 years back. Okay, and when people come in with these diagnoses, these symptoms, I always order an MRI. Okay, I know there are doctors out there and other physiotherapists and whatever, and they will say, well, you shouldn't have an MRI just because they come in with some radiation down their leg. And that's not what I'm saying, guys. Okay, but if you've had these problems for many months, okay, and you've been around to doctors and physios and orthopeds and nothing is really helping, it's really time that you yourself take charge of this, because people are just like, no one's going to be as interested as you are to reduce your back pain. Okay, so sometimes you got to be a bit pushy if you have a herniated disc or any other back condition. Okay, because the healthcare professions, me included, know that most back pain will disappear after 3 months. Okay, so our number one task is to check so you don't have any like life-threatening signs. Okay, and if you don't have that, most of the time we're just trying to get you to move and live as normal as possible, and just ride this out. But if you had this for 3 months and you've been around and nothing is helping, then please make sure that you get an MRI, because that's going to be able to tell you with very high accuracy if you have a slip disc or a herniated disc. Okay guys, that's today's tip, and guys, remember, just one step away from healing your back pain.